News reporter Marcy Jones has been digging into what we know about this potential spread. And Marcy, what have you learned here?
Well, Mark and Aaron, even though the new COVID variant Omicron may sound alarming, health officials are urging members of the public not to panic. This first confirmed case in the U.S. comes right as the CDC readies new testing protocols for international travel.
We knew that it was just a matter of time.
The U.S. has its first confirmed case of COVID caused by the new Omicron variant, found in a fully vaccinated patient in California. The individual traveled from South Africa on November 22nd and has mild symptoms and is self-quarantining.
You really can't take anything away from a single patient. We feel good that this patient not only had mild symptoms, but actually the symptoms appear to be improving.
The CDC is currently working to step up COVID testing requirements for travel to the United States. Right now, travelers have to be tested within 72 hours of arriving, but health officials are considering testing travelers one day before boarding U.S.-bound flights, regardless of their vaccination status or location.
I think you got to give these things a little bit of time, see what the experts have to say, and listen to the new guidelines.
Earlier, President Biden reiterated his plea to Americans.
The best protection against Omicron is getting a booster shot.
The CDC is expanding surveillance for Omicron at 4 of the busiest international airports in the country. And cities and states are also boosting their own surveillance, testing samples in wastewater.
As that information comes in, we can use it to do targeted approach to try to contain it.
Dr. Fauci says in the next few weeks, the U.S. expects to learn a lot more about Omicron's transmissibility and also the severity from countries like South Africa, which have larger numbers of confirmed and probable cases. Live in the newsroom, Marcy Jones, Channel 3 Eyewitness News.
Marcy, thank you very much. Right